One of the big outputs of the Games for Health project is the Games for Health conference, and it's amazing. I mean, you're talking about close to 300 or more people over 2 days, going to 20 to 40 sessions, and just getting to know each other, getting to see things that they had never seen before. And that's what's great. The Games for Health conference is the opportunity for us to see, as a community, where our story is and what's going on. And so far, each year it's gotten bigger and better, and the story's gotten richer.
I'm Dr. Ernie Medina. I'm a preventive care specialist at Beaver Medical Group, and basically I work with exercise and nutrition, stress management, quit smoking, and lifestyle-related diseases with patients. And I also am an assistant clinical professor at Loma Linda, working with graduate students who are in the same field. And I helped co-found and start up the XRtainment Zone, which is a family fitness and wellness center utilizing XR games as our main tool for increasing physical activity in kids and adults. In my day-to-day job, I work with patients trying to get them to exercise, and when I saw this first demonstration of an XR game about 10 years ago, it really got my imagination going, so I started looking at all the different games that are out there, and I said, one day I'm going to have all these XR games under one roof, and that's how the XRtainment Zone was born.
The seniors have really taken to XR gaming. Initially, they were a little bit leery of the idea of doing something that was considered a video game, but once they got into it, when they started moving their arms and their legs, and they actually felt their heart rate increase, they were really connected to that, and they saw that as a definite opportunity to spend more time with their grandchildren and their children at family functions. It was proving to be a new activity for them that they could engage in with members of their family.
Seniors come here, in my opinion, for a lot of the sense of community, sense of being social interaction, and just being here with a group of people working towards something, which here you're working towards better health, physically and mentally. And when they walk out the door, they're happy, they're healthy, they're sweaty, and they feel like they've really just contributed to a healthier lifestyle.
The Pulse project is an interesting example of what you could do with training in 3D worlds, and especially using game developers and game technologies. Claudia McDonald, who conceived of and founded and now manages the Pulse project at Texas A&M Corpus Christi, had this opportunity to look at what she thought the next level of health education would be.
Pulse is a first-person, high-fidelity, role-playing immersion learning platform. And it is intended to be a role-playing experience. You take on the role of the physician or the nurse, you live the life, you make the decisions, and you have the consequences of your decisions. If you give the wrong drug in the wrong way, or even if you give the right drug in the right way, patients still die. You do everything right and they die. Why did they die? You go back and you try to figure it out and do it again. And it is intended to provide clinical learning experiences that will supplement and replace the actual clinical learning experiences that students would have in the healthcare delivery system, whether they are a practicing physician training to treat people coming in from Iraq, or they are a medical student that is a fourth-year medical student that is also learning to treat people coming from Iraq, or the people at County General, wherever County General might be.
You got a sound. The sound is actually correlating.
Yeah.
Pulse System, it's a great learning venue because as you practice it and start playing with it, you become immersed in it. And all of a sudden, it's not so much a game, it actually becomes real life as you're treating this patient. If the patient's blood pressure is dropping, you're working very hard to get it back up. You're using your team, you're using the nurses and the technicians to come in and help you resuscitate the patient and treat this patient. So it's not it's not so much an artificial venue. When you start playing the game, it becomes very realistic.
This really is, in my mind, this is an opportunity to sort of redefine education in a very meaningful field, which to me has a lot of value, but that's sort of why I'm here. I've been doing entertainment software development for about 14 years, and as soon as I heard about this, I got here as quick as I could.
What Remission has shown us is that you can embed within a game an experience and information attached to that experience that communicates to the person playing the game about things relevant to their health and healthcare, and that experience can have an effect on how they view themselves, how they view this disease they might have, or this illness or condition they might have, and maybe some ways they can think about how to take action about it, or be a better patient.
We took him to his pediatrician, who had been with him for 11 years, knew him really well. She ran some tests, and right then and there brought me back into the office and said, I have to tell you some really, really distressing news. He has leukemia.
Well, before I had my bone marrow transplant in Seattle, I heard about this, or my dad actually heard about this amazing game called Remission. So my dad hunted Hope Labs down, which is the creator of Remission, and it turns out that they send the video game to people that are going through their battle for absolutely no cost. They'll even pay for shipping.
The educational component comes about in a real fun way, where kids begin to learn that if they take chemotherapy, there are certain medications that they can take to help with the nausea and the vomiting and the feeling sick. It's a way to help them battle back when they're feeling sick. It teaches them about how cancer can affect certain organs, how it can flow through. It teaches them about different types of cancer that other kids may have, but they may not. It's extremely educational and beneficial, but all in a really fun way.
Yes, I was just so thankful for Remission and amazed with it that I decided to do my science fair project on it. And yeah, I just found some amazing data of how they enrolled people across the country and in other countries. And it was just amazing because they had a control group, and then they had a group that played Remission. And it was amazing what Remission did. It just showed amazing, like they actually had higher levels of chemotherapy, they had higher antibiotic utilization, and I guess the judges liked it because now I'm moving on to the county science fair, and yeah, I won for my school.